Hi, good afternoon everyone. As you may have noticed that there is a sudden rapid increase in the number of cases of mucormycosis, which is a rare fungal infections in the current COVID-2 pandemic. Now there are a lot of factors which have contributed to this, which is unscrupulous use of steroids by patient at home and without a medical supervision. Generally, patients who were pre-diabetic or who were diabetic have taken steroid, and because of that, the blood sugar levels in the body have soared up very high, which is a risk factor and a food for the fungi. Now we are seeing a lot of cases every day in the OPD, about 10 to 12 cases in the OPD. The first symptom may be involvement of the sinuses and the nose, where a patient may notice a bloody thick nasal discharge, maybe blood stained, unilateral facial pain, headaches, eye pain, decrease in vision, diplopia, and sometimes a swelling on the left side of the or the right side of the face. Now, whenever a patient comes with this, he is COVID recovered, he has taken steroid, his sugar is uncontrolled, the risk of getting mucormycosis is high. Just a routine nasal endoscopy and taking a KOH swab from the affected site or a pus can give us the diagnosis. Once a patient is diagnosed with mucormycosis, we need to admit these patients, start them on amphotericin B, which is available. Patients who are renal compromised and have got high creatinine levels need to take liposomal amphotericin B, which is an expensive drug as compared to basic amphotericin B. Early debridement of the sinuses, removal of the fungus can prevent the spread of this infection from the nose and the sinuses into the orbit, because once the orbit gets involved, the patient loses his vision, and then the option of just removing the orbit is only left. Involvement of the orbit is also a risk factor to the brain, in which case the disease proves to be fatal in up to 80% of the cases. So please, if you have been discharged, please pick up the early signs, consult your ENT surgeon, get a nasal endoscopy and start your treatment early to prevent any morbidity or mortality in this disease.